So what's up guys, this is Mobeen. We are talking about the labs for hepatitis B virus. Many of these labs students get confused, especially they get confused by the window period and then they get confused for which lab means what. So we'll talk about that today. Now to understand the labs, what is important is to understand the function of the hepatocyte in context to this particular hepatitis, not all the functions right now. And secondly, to understand how the virus causes the damage so that we can understand the labs. Of course, we also need to understand how the body is going to mount a response or how the defense mechanisms will work. So let's do these things very fast. First of all, in this context, a hepatocyte, remember this thing, that the ALT enzyme is present in the cytoplasm of the hepatocyte and AST enzyme is present in mitochondria. Now, when you're comparing the labs of a chronic alcoholic versus the labs of hepatitis, viral hepatitis, here is how you would differentiate them. Look, when a virus enters a cell, hepatocyte, it will replicate inside the cell finally to cause the cell to burst open. When the cell will burst open, what do you think will spill out? Cytoplasm would spill out. Now cytoplasm has what enzyme? ALT. Mitochondria will spill out as well and they will break as well and they would release AST. However, cytoplasm has more abundant enzymes, so ALT levels in these patients are going to be higher than the AST levels. So viral infections have greater quantities of ALT compared to AST. On the other hand, in the chronic alcoholics, the problem is that liver is metabolizing a lot of ethanol or alcohol. That increased metabolism of alcohol causes oxidative stress on the liver enzymes. Can it cause the stress on the other cells? Yes, but liver is the primary target because it has to break down the alcohol. So that oxidative stress causes mitochondria to break down. When the mitochondria are broken down, what enzyme is going to be released? AST, right? So in chronic alcoholics, AST is going to be increased in quantity compared to ALT. So this is the difference between viral and alcoholic liver disease labs for the liver enzymes. Now the second concept to keep in mind, which we'll use, is the incubation period. Incubation period is the duration from the first infection to the time of the symptoms to appear. In the case of hepatitis B virus, the incubation period is about 1.5 months to 6 months, so average 4 months. So a patient who gets exposed today might have the symptoms somewhere in about 1, 2, 3, 4 months, can go up to 6 months. Next concept to keep in mind is the window period. Window period is a very interesting concept and very easy concept actually. The concept is this: look, when the antigens are the foreign substances that are harmful to our body, or our body thinks at least that these are harmful. When the antigens come in, what do? We make antibodies to fight these antigens. In the beginning, antigens are going to be more. Antibodies are going to be less. So if you measure them, you will see a lots of antigens. And as the body continues to make the antibodies, then these antibodies will become complexed with the antigen. And when you run the labs, the immunoassay systems, they only measure independent antigen or antibody. They will not measure the immune complexes. So imagine now that there is antigen present and then there is antibody present, and antibody comes and binds with the antigen. Now if there were 5 antigens and there was 1 antibody, then the measurement system would say I have 4 antigens. If there are 3 antigens and then there are 3 antibodies, so they both are present, or 5 antigens and 5 antibodies, they both are present, infection is there, body is also responding, what do you think the measurement system will measure? Measurement system will measure 0. Why? Because the antigens, all of them are, let's say these are 5 antigens and these are 5 antibodies, they all have become complexed with each other, and the measuring system would say 0 antigen and 0 antibody. Now, would you consider that as a period of non-infection? No, that is an active period of infection. However, our measuring system just cannot detect the antigen and antibody because all of them are complex with each other. This is called a window period. This is also called zone of equivalence in immunology. Zone of equivalence is when the antigen and antibody quantities are equal to each other and they neutralize each other by complexing. So we will see that hepatitis B surface antigen and hepatitis B surface antibodies do form a zone of equivalence. However, it is a rare occurrence. It is not very common. You shouldn't say that every patient should have a zone of equivalence in their lab tests. That will not happen. It is a rare occurrence, but it can happen. And when it happens, you should know to see other antigens and see if they are present, and that will tell you if the infection is going on. We'll talk about that more today. After this, let's talk about the virus itself. So remember that when the particle is present inside a cell, viruses are intracellular because they need the cell's machinery to work, right? To replicate. So when it is present inside the cell and it is replicating, it is called a virus. When it comes out of the cell, it is a virion. It is not able to replicate by itself. So the structure of the virus is called the virion. Active virus inside the cell is a virus. Now, hepatitis B virus belongs to HepaDNA virus family. This is an enveloped virus with an icosahedral nuclear capsid. Icosahedral is 20 faces. So it has the nuclear capsid that has 20 faces to it. Now within the nuclear capsid, there is a partially double-stranded DNA. Now what is important about this one? The important thing about this virus from lab's point of view, the things that we measure, are it has 3 antigens that are interesting for us and that we can measure. One are surface antigen. So the viral envelope exhibits antigens which are called hepatitis B surface antigen. So HBs for surface, Ag for antigen. Then it has the core. Core is that nuclear capsid or nucleocapsid that is around the nucleus. That core is an antigen as well. And when that breaks and is found in the serum, then we will call that hepatitis B C, C for core, antigen. So HBc antigen. Now there is one more interesting thing, and that is when the virus is sitting in the hepatocyte and it is actively replicating, it can actually secrete the core antigens. The cell, the hepatocyte, can secrete the core antigens. That secreted component of the core antigen of the virus is called E antigen. So that will be hepatitis B E antigen, HBeAg. And that is really secreted component of the core antigen. So these are the 3 most important antigens. There are other antigens like P and X. We are not really concerned about those at this time. Now let's look at how this virus and these antigens and the antibodies will work. Look, this virus, when it comes into our body and it enters, it has an incubation period of, let's say, two months. It incubates and then enters. It's sitting in the hepatocytes. It is infecting them. It is replicating. Now what happens is, it starts when the hepatocyte will have the virus in it. Hepatocyte will exhibit, like all nuclear cells, they will exhibit the viral antigens on their surface with the MHC1 complex. This is true for all cells. Any cell that gets infected will show the viral antigen on its hand, which is MHC1, to the immune cells. This is like it is telling the immune cells that, hey dude, look, I got infected. Can you see what this thing is? So cytotoxic T cells can bind with that MHC1 and the antigen, and they will initiate the immune defense mechanism causing inflammation and necrosis of that cell. They would kill the hepatocyte. So that is their mechanism of saving from the infection, and that is just kill the cell that has infection in it. That is what causes liver inflammation and necrosis. So that is one thing. Second mechanism, so our body works through both the cytotoxic and humoral responses to the hepatitis B. So of course, what is a humoral response? We will produce antibodies. So antibodies to what? To the surface antigens, to the core antigens, and to the E antigens. So what happens is every time the cell breaks down or hepatocyte secretes E antigen, then it breaks down as well and mature virions come out. With them, the broken particles of the viruses also come out, which will have hepatitis B surface antigens and which will have hepatitis B core antigens. When these antigens are present, you know what happens from immunology. These antigens will trigger the the helper T cells. Helper T cells would activate the B cells. B cells will make antibodies. So what kind of antibodies will we make now? We'll make hepatitis B surface antibodies. To what antigen? Hepatitis B surface antigen. So for every antigen there is an antibody. So HBsAg will have an antibody which is HBsAb antibody. HBcAg, hepatitis B C antigen, will have HBcAb, which is hepatitis C antibody. And similarly, HBe antigen, Ag, will have HBeAb or antibody. So all three can be present. Now the question is, this is what is interesting, which one is present and what does it mean? So for that, as we look at the graph, understand that we as practitioners should be able to figure out, as doctors, as people who are practicing, that when you receive the labs, you have to look at the lab and sort of understand if this is a vaccinated person or if it is an acute infection, if it is an acute highly infective and highly replicative state, or if it is a chronic infection, or if it is a chronic lower infectivity state, chronic high infectivity state, or if it is a resolved state. You have to be able to detect all of them, and it's very easy actually. So let's start. First, I want to handle the concept of window period with the chart. So we will not look at all of those together. Let's look at hepatitis B surface antigen. So let's look at this graph here. What will happen is that after the incubation period, about a month or 2 months, the hepatitis B surface antigen titer or the quantity will start rising. Why will that start rising? The virus was sitting in the hepatocyte, it is replicating, and the antigens are now found in the serum. At that time, body will start making hepatitis B surface antibodies. So you say, okay, stop here. In the graphs, they never show anti-hepatitis B surface antibodies in this place. That is true. In that early time, the hepatitis B surface antibodies are so low in quantity that our immunoassay systems do not detect them. And whatever tiny amount is present, that is bound to the hepatitis B surface antigens. Even then the antigens are more. So you can think it this way. There are 20 antigen and 4 antibodies. So all those 4 are complexed with the antigens, and there still are 16 more antigens. So the immunoassay system will only see the antigens and not the antibodies. Then as the antibodies continue to increase, the antigen quantity will become more and more complex, and so the quantity will now start reducing. So about 4 or 5 months later, if we are able to handle the virus, then the hepatitis B surface antigen will actually come down to 0. What does that mean? Does that mean that the virus has gone away? Most of the time, that would simply mean that the virus is still present, it is still making antigens. However, antibodies are also enough in number that they have become complex, and the antigen antibody are equal in number, in amount, and so immunoassays are not picking up antigens or antibodies, and now we are in a zone of equivalence. We are in the window period. In this window period, hepatitis B surface antigen, which is the most important marker to say that we have infection or not, is disappeared. Now, how do we figure out if a patient still has the infection? How do we know that infection is going on? Some other antigen or antibody will be present. Most of the time, hepatitis B core antibody, if that is present, then you can say that the patient has the infection. Cool, so that is the window period. So after the window period, what happens is, hopefully the defense mechanisms have removed the virus and virions, and now what do you think? The hepatitis B surface antibodies are still present, but the antigens are gone now. So what do you think will happen to the quantity of the surface antigen antibodies? These will now increase. So now we have 1,000 antibodies sitting and saying, okay, where is the virus? I'm here, but there is no virus. So the immunoassay systems will now detect a higher titer or quantity of hepatitis B surface antibodies. And that is what we say, that after 5 or 6 months, you would see increase in hepatitis B surface antibodies. These appear, but please now remember, that doesn't mean that these were not present before. These were present before, it's just that they were in low enough quantity that these could not be measured, and whatever was present was complex with the antigen. Okay, so that hopefully clarifies the window period. Now let's talk about the hepatitis B core antigen. Core antigen normally appears after the surface antigen appears, and it normally is managed by our body before the surface antigen is managed. So it appears after and it disappears before. So it is under the umbrella of the surface antigen. And again, what is the mechanism of it disappearing? Simple. When the antigen starts appearing, our body would make antibodies to it. Those antibodies would complex with that, just like with the surface antigen. And that complexity, or that complex, would clear out one virus plus the antigens. So this is a core antigen. What antibody will be formed? Hepatitis B core antibody. So you can say that the core antibody will start appearing, and this is interesting. Core antigen is very tiny in quantity, but core antibody is large in quantity. And so there will be a huge spike of the antibody which will stay for longer. Now, hepatitis C antibody comes in two flavors. One is, of course, the acute response, and that is IgM type, and the other one is the long-lasting response, or IgG type. So IgM for immediate, right? So immediate response. So what will happen is that as the about third month, as the core antigens start appearing, you will see hepatitis B core antibodies to appear and go very high in the titer. Then you would see hepatitis B core antibody type IgM to reduce. So imagine if there were 5 IgM type and 5 IgG type, so total was 10. So now 5 will drop off. IgM is immediate, it comes in an acute phase and then goes away very fast. What would be left? About 5 of the IgG will be left. Or the class switching would happen on 6 or 7 or 8 IgG. So the point is, IgM will drop off and IgG would continue. And we can measure that. And measuring that would tell us if it is acute or chronic infection. And finally, the antigen E. Antigen E is secreted component of core. It actually tells us it is like a bomb inside the cell. And so it would tell you that cell is in high replication state with high infectivity state. So this is a very dangerous state. The patient is very infective. The virus is very active. So in any of your exams or in any of your labs, when you see hepatitis B E antigen positive, then you should know that virus is very actively replicating. If you see hepatitis B C antigen active or present, that means virus is active and replicating, but it is low in rate of replication. It is less infective, it is less dangerous. Now let's look at a graph here where we can discuss what kind of antigen antibody measurements will interpret it in what way. So first of all, let's say you receive a patient and you suspect that the patient has hepatitis, and you get the labs, and the labs come back and you see this. You see hepatitis B surface antigen negative. Actually, you see all antigens negative. However, hepatitis B surface antibody is positive. What do you think is going on? So this is a patient who has gotten vaccine for the hepatitis B. So hepatitis B vaccines are targeted to the surface antigens. That is why when this vaccine is present, let's say if it is given to me and I didn't have the virus, then all I would show is hepatitis B surface antibody. So first check mark for you. If you only see the antibodies for surface antigen, but there is no antigen of any kind, then it is a vaccinated person. Then second, acute infection. What will happen in the acute infection? What kind of HBs or HBc you would see? AB, what kind of antibody you will see? You will see IgM type, right? That is acute. So if you see hepatitis B core antibody of type IgM, if that is what is given to you in the lab, then suspect that there is an acute infection going on. Now, is it the first time infection or it was a chronic infection with a flare up of infection? You don't know. But there is acute replication happening. Now, if there is IgM of hepatitis B core antibody, IgM type, plus there is also HBsAg, that is the hepatitis B surface antigen present, then what do you have? Once again you have acute hepatitis. Now, how will the acute hepatitis be resolved? It will be resolved when there will be antibodies produced which will clear out the virus and the antigens. So when the antibodies are present and the other things are cleared out, what will you see in the resolution? You will see no antigens. So hepatitis B surface antigen negative, hepatitis B core antigen negative, hepatitis B E antigen negative, but you would see antibodies to be present. So these are the policemen sitting in there and saying, okay, now we gotcha. So what are you going to see? You're going to see hepatitis B surface antibody to be positive, and you would see hepatitis B core antibodies to be present. So if that is the case, and you may have hepatitis B E antibodies to be present or not present, doesn't matter. If you have antibodies present but no antigens, you know that this is a resolved state. Now let's talk about chronic state. How do you know it is chronic? Very simple. Look at hepatitis B core antibody. If that is of IgG type, then that means that is a longer lasting activity going on. So that is chronic. Why is body still making it? Because body did a class switching after months and we are still making the antibodies because antigens are still present. The patient is in a chronic state. Chronic state is defined as hepatitis B surface antigen present greater than 6 months. Of course, then the antibodies will be present for greater than that time as well. So this is one, that IgG is present. Secondly, IgG might be accompanied by HBs, hepatitis B surface antibody as well. So now you have two antibodies. That still is chronic. Now the thing to see is if the antigen E is present or antibody E is present. If antigen E is present, that is hepatitis B E antigen present, then the patient is in a chronic state with high infectivity. So virus may have flared up again and it is replicating. if you see hepatitis E, hepatitis B, not E, hepatitis B E antibody, that means that the E antigen is under control and the patient is in low virality or low infectivity. Now finally, the carriers. What is the carrier state? Carrier state is where the hepatitis antigens, virus is present, it is making antigens. The antigens and antibodies are equal in amount. The virus is under check. These patients are not tolerant. It's just that immune system is managing the virus very well. That is a carrier state. So about 5% are in the carrier state. The 70% will have acute and then they would resolve. 10% may have chronic, and then 1% can have a fulminant disease in which the death can occur. So this is the labs for the hepatitis B. Thank you very much.